This is Dr. Eric Donor to talk to you about mesotherapy, also called Lipodissolve and currently called injection lipolysis. Here we have a typical patient who wishes to reduce some of the fat around her midsection. She either does not wish to go through liposuction or is not a good candidate. You can see we're checking the amount of fat in the area and assessing the patient's needs. By doing this, we can give you a better sense of how well you will do with this therapy, which was developed several years ago in France. We're using this ring to tell us exactly how much of the medication can be injected into the fat at any one time and what's the area that can be improved. By squeezing the fat, we can assess the amount of fat that is present. And what we're doing in this region is laying out where we'll be injecting the medication. The medication uses standard formula of salt water and phosphatidylcholine, which is lecithin, an FDA-approved product, which is used as a food supplement, mixed with a bile salt. We mix it up right before the treatments in order to provide the freshest medication available for you. When we're choosing the amount to inject for a patient, it depends on the patient's weight and needs. We use very tiny needles to inject, and it goes up to the hub. When we're injecting into the fat, it goes into the fat and dissolves throughout. This gives a nice and even reduction of the fat. As you can see, we inject the area with the medication in a predetermined way, and then the medication will spread out to the surrounding areas, causing breakdown of the fat cells, which then gets reabsorbed by way of the bloodstream and is detoxified by the liver and the kidneys. It is perfectly safe for the kidneys and the liver, and no problems with cholesterol levels, triglyceride levels, or liver enzymes has ever been seen. We do it in a symmetrical fashion, meaning on both sides of the body, the abdomen, the hips, the bra fat, the upper abdomen, thighs, but not the buttocks. The injections are painless. We can ice down the area. Afterwards, you can see that the area does become somewhat red, slightly inflamed, slightly sore. Sometimes it's a little itchy, and you might want to wear loose pants afterwards. The area then settles down after that, and you have your maximum benefit 2 months after the fact. And you can see both sides are somewhat red and irritated, and that is an expected and desired result. You can see 3 days later, there's a certain amount of bruising. The small divot on the patient's skin was from a previous scar and not from the injections themselves. This is a while later, after a single treatment, and you can see that the fat has started to be reduced already. At this point, a week later, there's really no discomfort. There might be a little bit of bruising left over. That goes away very quickly.